CPR certification exam newest. Question 1. What is the very first step when you encounter a person who appears to have collapsed? Option A. Check for a pulse. Option B. Start chest compressions. Option C. Verify that the scene is safe for you and the victim. Option D. Give 2 rescue breaths. The correct answer is option C. Verify that the scene is safe for you and the victim. Safety is the priority. You cannot help a victim if you become a victim yourself due to traffic, fire, or electrical hazards. Question 2. When checking for responsiveness in an adult, what should you do? Option A. Punch them in the arm. Option B. Splash water on their face. Option C. Tap their shoulders and shout, "Are you okay?" Option D. Check their pupils with a light. The correct answer is option C. Tap their shoulders and shout, "Are you okay?" Tapping the shoulders and shouting is the standard method for assessing consciousness in adults and children. Question 3. What is the recommended rate of chest compressions for victims of all ages? Option A. 60 to 80 per minute. Option B. 80 to 100 per minute. Option C. 100 to 120 per minute. Option D. 140 to 160 per minute. The correct answer is option C. 100 to 120 per minute. High-quality CPR requires a rate of 100 to 120 compressions per minute to maintain adequate blood flow to the brain and heart. Question 4. What is the correct depth of compressions for an adult victim? Option A. At least 1 inch. Option B. At least 2 inches, but no more than 2.4 inches. Option C. At least 3 inches. Option D. No more than 1.5 inches. The correct answer is option B. At least 2 inches, but no more than 2.4 inches. Compressions must be deep enough to physically squeeze the heart. For adults, this is 2 to 2.4 inches, 5 to 6 centimeters. Question 5. Why is it important to allow the chest to fully recoil between compressions? Option A. It gives the rescuer a break. Option B. It allows the heart to refill with blood. Option C. It prevents broken ribs. Option D. It helps the lungs deflate. The correct answer is option B. It allows the heart to refill with blood. Full recoil creates negative pressure in the chest, which pulls blood back into the heart chambers for the next compression. Question 6. What is the correct ratio of compressions to breaths for one rescuer adult CPR? Option A. 15:2. Option B. 30:2. Option C. 30:1. Option D. 5:1. The correct answer is option B. 30:2. The universal ratio for one rescuer CPR across all ages, except neonates, is 30 compressions followed by 2 breaths. Question 7. When an AED becomes available, what is the first thing you should do? Option A. Plug in the pads. Option B. Clear the victim. Option C. Turn on the AED. Option D. Apply the pads to the chest. The correct answer is option C. Turn on the AED. Turning on the device is the first step because the AED will then provide voice prompts to guide you through the rest of the process. Question 8. Where should you check for a pulse on an unconscious adult? Option A. The wrist, radial. Option B. The neck, carotid. Option C. The groin, femoral. Option D. The ankle. The correct answer is option B. The neck, carotid. The carotid artery in the neck is the most reliable site to check for a pulse in an adult during an emergency. Question 9. How long should you spend checking for a pulse and breathing before starting compressions? Option A. No more than 5 seconds. Option B. At least 10 seconds. Option C. Between 5 and 10 seconds. Option D. Exactly 20 seconds. The correct answer is option C. Between 5 and 10 seconds. Assessment should be quick to minimize delays in starting CPR, but long enough to be sure, no more than 10 seconds. Question 10. When using an AED, where should the pads be placed on an adult victim? Option A. Upper left and lower right. Option B. Upper right and lower left side of the chest. Option C. Both on the back. Option D, directly over the center of the chest. The correct answer is option B, upper right and lower left side of the chest. Standard placement is the upper right chest, below the collarbone, and the lower left side, below the armpit. Question 11. What should you do if the AED prompts no shock advised? Option A, turn off the AED and wait for help. Option B, check for a pulse for 2 minutes. Option C, immediately resume CPR, starting with chest compressions. Option D, give 5 rescue breaths. The correct answer is option C, immediately resume CPR, starting with chest compressions. If no shock is needed, blood is not circulating effectively, so you must resume manual CPR immediately until the AED reanalyzes. Question 12. What is the correct compression depth for an infant under 1 year old? Option A, about 1 inch. Option B, about 1.5 inches, 1/3 the depth of the chest. Option C, about 2 inches. Option D, a depth does not matter for infants. The correct answer is option B, about 1.5 inches, 1/3 the depth of the chest. Infant compressions should be approximately 1/3 the depth of the chest, which is about 1.5 inches, 4 centimeters. Question 13. Which technique is preferred for one rescuer infant chest compressions? Option A, the heel of one hand. Option B, 2 fingers, index and middle, in the center of the chest. Option C, the thumb encircling technique. Option D, the heel of 2 hands. The correct answer is option B, 2 fingers, index and middle, in the center of the chest. For a single rescuer, 2 fingers allow the other hand to maintain the head tilt to keep the airway open. Question 14. What is the correct ratio for 2 rescuer child CPR? Option A, 30:2. Option B, 15:2. Option C, 15:1. Option D, 10:1. The correct answer is option B, 15:2. In 2 rescuer CPR for children and infants, the ratio changes to 15:2 to provide more frequent oxygenation. Question 15. When providing rescue breaths with a bag mask device, how much air should you deliver? Option A, a full lungful of your breath. Option B, until you feel high resistance. Option C, just enough to see the chest rise. Option D, as much as possible as fast as possible. The correct answer is option C, just enough to see the chest rise. Excessive ventilation can cause gastric inflation, air in the stomach, and reduce blood return to the heart. Question 16. If a victim is submerged in water, what must you do before using an AED? Option A, nothing, AEDs are waterproof. Option B, pull them out of the water and quickly wipe the chest dry. Option C, wait 10 minutes for them to air dry. Option D, only apply the pads to their back. The correct answer is option B, pull them out of the water and quickly wipe the chest dry. Water conducts electricity, so the chest must be dry to ensure the shock travels through the heart and the pads stick properly. Question 17. How often should rescuers switch roles during 2 rescuer CPR to prevent fatigue? Option A, every 1 minute. Option B, every 2 minutes, or after 5 cycles of 30:2. Option C, every 10 minutes. Option D, only when the first rescuer stops breathing. The correct answer is option B, every 2 minutes, or after 5 cycles of 30:2. Compression quality drops significantly after 2 minutes due to fatigue, even if the rescuer doesn't feel tired. Question 18. What is the hand placement for adult chest compressions? Option A, the upper third of the sternum. Option B, the lower half of the sternum, center of the chest. Option C, on the left side over the heart. Option D, on the stomach. The correct answer is option B, the lower half of the sternum, center of the chest. Compressions should be delivered on the lower half of the breastbone, sternum, to effectively squeeze the heart against the spine. Question 19. What should you do if you are alone with an infant who is unresponsive and not breathing? Option A, call 911 immediately before doing anything. Option B, perform 5 cycles, about 2 minutes, of CPR, then carry the infant with you to call 911. Option C, wait for someone else to arrive. Option D, check the brachial pulse for 30 seconds. The correct answer is option B. Perform 5 cycles, about 2 minutes, of CPR, then carry the infant with you to call 911. In infants and children, the cause is usually respiratory, so providing 2 minutes of CPR first can be life-saving before leaving to activate EMS. Question 20. Where do you check for a pulse on an infant? Option A, a carotid, neck. Option B, radial, wrist. Option C, brachial, inside of the upper arm. Option D, femoral, groin. The correct answer is option C, brachial, inside of the upper arm. The brachial artery is the easiest and most reliable pulse point to locate on an infant. Question 21. What is the correct action for a conscious adult who is choking and cannot cough or breathe? Option A, give 5 back blows only. Option B, perform abdominal thrusts, Heimlich maneuver. Option C, give 2 rescue breaths. Option D, wait for them to pass out. The correct answer is option B, perform abdominal thrusts, Heimlich maneuver. Abdominal thrusts create an artificial cough to force the obstruction out of the airway. Question 22. How do you treat a conscious infant who is choking? Option A, abdominal thrusts. Option B, slap them on the back as hard as possible. Option C, 5 back blows and 5 chest thrusts. Option D, finger sweep the mouth immediately. The correct answer is option C, 5 back blows and 5 chest thrusts. Abdominal thrusts can damage an infant's liver. The 5 and 5 cycle of back blows and chest thrusts is the standard. Question 23. When should you perform a finger sweep on a choking victim? Option A, every time you give a breath. Option B, only if you can see the object in the back of the throat. Option C, whenever the victim stops breathing. Option D, to check if they have teeth. The correct answer is option B, only if you can see the object in the back of the throat. Blind finger sweeps can push an object deeper into the airway. Only remove it if it is visible. Question 24. What is the goal of high-performance CPR? Option A, to look professional. Option B, to minimize interruptions in chest compressions to less than 10 seconds. Option C, to use the newest AED. Option D, to perform CPR for 1 hour without stopping. The correct answer is option B, to minimize interruptions in chest compressions to less than 10 seconds. Minimizing interruptions, high chest compression fraction, is the most critical factor in survival from cardiac arrest. Question 25. True or false, you can use adult AED pads on a child if child pads are not available? Option A, true. Option B, false. The correct answer is option E. If child-specific pads or a pediatric dose attenuator are not available, use adult pads. It is better to provide a higher level shock than no shock at all. Question 26. Can you use child AED pads on an adult? Option A, yes. Option B, no. The correct answers are options F and A and E, yes. Child pads are designed to reduce the energy of the shock, which is insufficient to restart an adult's heart. Question 27. A victim has a pulse but is not breathing. What should you do? Option A, start chest compressions. Option B, perform rescue breathing, 1 breath every 6 seconds for an adult. Option C, do nothing and wait for the pulse to stop. Option D, give breaths as fast as possible. The correct answer is option B. Perform rescue breathing, 1 breath every 6 seconds for an adult. If a pulse is present, the heart is still working, but the victim needs oxygen, respiratory arrest. Question 28. What is the correct rate of rescue breathing for a child or infant? Option A, 1 breath every 6 seconds. Option B, 1 breath every 2 to 3 seconds. Option C, 1 breath every 10 seconds. Option D, 5 breaths every minute. The correct answer is option B, 1 breath every 2 to 3 seconds. Children and infants have faster baseline respiratory rates and require more frequent breaths than adults. Question 29. If a victim is pregnant and choking, where should you perform thrusts? Option A. On the abdomen as usual. Option B. On the chest, chest thrusts. Option C. Under the armpits. Option D. You cannot perform the Heimlich on a pregnant woman. The correct answer is option B. On the chest, chest thrusts. Chest thrusts avoid putting pressure on the developing fetus while still clearing the airway. Question 30. What does clear mean when the AED is analyzing or delivering a shock? Option A. Everyone should touch the victim to help. Option B. No one should be touching the victim. Option C. The airway is clear. Option D. The victim is awake. The correct answer is option B. No one should be touching the victim. If someone touches the victim during analysis, it can interfere with the heart rhythm reading. During a shock, the rescuer could be injured. Question 31. Which of the following is a sign of poor air exchange in a choking victim? Option A. Forceful coughing. Option B. A wheezing between coughs. Option C. A weak, ineffective cough or a high-pitched crowing noise. Option D. The victim's face is red. The correct answer is option C. A weak, ineffective cough or a high-pitched crowing noise. If the victim cannot cough forcefully, the airway is nearly or completely blocked, and you must intervene. Question 32. What is the first thing you should do if an infant becomes unresponsive during choking relief? Option A. Start compressions. Option B. Call 911 immediately. Option C. Check the pulse. Option D. Open the airway and look for the object. The correct answer is option A. Start compressions. Once a choking victim passes out, they are now a cardiac arrest victim, so you start with CPR, compressions. Question 33. Why is gastric inflation, air in the stomach, dangerous? Option A. It makes the victim vomit, which can be aspirated. Option B. It makes the person look fat. Option C. It helps them breathe better. Option D. It increases the pulse rate. The correct answer is option A. It makes the victim vomit, which can be aspirated. Air in the stomach pushes on the diaphragm and often causes vomiting, which can block the airway or enter the lungs. Question 34. What is vaginal gasp? Option A. A sign of normal breathing. Option B. A rhythmic breath. Option C. An ineffective, snoring/gasping sound that is a sign of cardiac arrest. Option D. A type of sneeze. The correct answer is option C. An ineffective, snoring/gasping sound that is a sign of cardiac arrest. Agonal gasps are not normal breathing. If you see them in an unresponsive victim, you must start CPR. Question 35. When should you move a victim who is receiving CPR? Option A. Every 5 minutes to change the view. Option B. Only if the scene becomes unsafe or the victim is on a soft surface like a bed. Option C. Never, even if a fire starts. Option D. Only if the family asks you to. The correct answer is option B. Only if the scene becomes unsafe or the victim is on a soft surface like a bed. CPR is most effective on a firm, flat surface. Minimize movement to maintain compression quality. Question 36. What is the head tilt/chin lift used for? Option A. To check for a pulse. Option B. To open the airway by pulling the tongue away from the back of the throat. Option C. To look at the victim's eyes. Option D. To prevent neck pain. The correct answer is option B. To open the airway by pulling the tongue away from the back of the throat. This is the standard maneuver for opening the airway in a victim without suspected spinal trauma. Question 37. What maneuver should be used to open the airway if a spinal injury is suspected? Option A. Head tilt/chin lift. Option B. Jaw thrust. Option C. Neck roll. Option D. No maneuver should be used. The correct answer is option B. Jaw thrust. The jaw thrust allows the rescuer to open the airway with minimal movement of the neck and spine. Question 38. If you are using an AED and notice a pacemaker, a lump under the skin on the chest, what should you do? Option A. Place the pad directly over the lump. Option B. do not use the AED. Option C. Avoid placing the pad directly over the device, place it at least 1 inch away. Option D. Remove the pacemaker. The correct answer is option C. Avoid placing the pad directly over the device, place it at least 1 inch away. Placing a pad over a pacemaker can block the shock or damage the device. Question 39. What is the compression to ventilation ratio for a newborn, neonate? Option A, 30:2. Option B, 15:2. Option C, 3:1. Option D, 10:1. The correct answer is option C, 3:1. Neonatal CPR, in the first hours/days of life, focuses heavily on ventilation, with a 3:1 ratio. Question 40. How do you know if your rescue breaths are effective? Option A. The victim's pulse increases. Option B. The victim wakes up. Option C. You see the chest rise with each breath. Option D. The AED stops beeping. The correct answer is option C. You see the chest rise with each breath. Chest rise is the only objective sign that air is reaching the lungs. Question 41. A victim has a medication patch on their chest where the AED pad needs to go. What do you do? Option A. Place the pad over the patch. Option B. Remove the patch and wipe the area clean before applying the pad. Option C. Place the pad on their leg. Option D. Do not use the AED. The correct answer is option B. Remove the patch and wipe the area clean before applying the pad. Medication patches can cause skin burns and block the electrical current if left under an AED pad. Question 42. In child CPR, 1 year to puberty, you should use option A. The heel of 1 or 2 hands. Option B. 2 fingers only. Option C. Your thumb. Option D. Your foot. The correct answer is option A. The heel of 1 or 2 hands. Depending on the size of the child, you may use 1 or 2 hands to reach the 2-inch depth. Question 43. When performing CPR on a victim who has drowned, when do you start? Option A. Compressions first. Option B. Give 5 rescue breaths first, then start compressions. Option C. Only after the water is out of their lungs. Option D. Wait for the AED. The correct answer is option B. Give 5 rescue breaths first, then start compressions. Drowning is a primary respiratory event, so many guidelines suggest starting with breaths to provide immediate oxygen. Question 44. What should you do if a choking victim is too large, obese, for you to reach around their waist? Option A. Do nothing. Option B. Perform chest thrusts instead of abdominal thrusts. Option C. Try to lift them up. Option D. Push on their back only. The correct answer is option B. Perform chest thrusts instead of abdominal thrusts. Chest thrusts, on the sternum, are the alternative for pregnant or obese victims. Question 45. The universal sign for choking is option A. Screaming for help. Option B. Pointing at the mouth. Option C. Clutching the throat with one or both hands. Option D. Sitting down. The correct answer is option C. Clutching the throat with one or both hands. This is a nonverbal cue that the airway is blocked. Question 46. What is the depth of compressions for a child, 1 year to puberty? Option A. 1 inch. Option B. At least 1/3 the depth of the chest, about 2 inches. Option C. 3 inches. Option D. Depth doesn't matter. The correct answer is option B. At least 1/3 the depth of the chest, about 2 inches. Child depth is 2 inches, 5 centimeters, similar to adults but slightly less forceful. Question 47. Which of the following is not a life-threatening sign during your initial assessment? Option A. Heavy bleeding. Option B. Unresponsiveness. Option C. A broken finger. Option D. No breathing. The correct answer is option C. A broken finger. While painful, a broken finger is not an immediate threat to life compared to ABC issues. Question 48. In a 2-rescuer situation, how often should you switch compressors? Option A. every 5 minutes. Option B, every 1 cycle. Option C, every 2 minutes or when the AED prompts a reanalysis. Option D, only when the ambulance arrives. The correct answer is option C, every 2 minutes or when the AED prompts a reanalysis. Switching during AED analysis minimizes the time the chest is not being compressed. Question 49. What is the purpose of the AED? Option A, to restart a heart that has flatlined asystole. Option B, to deliver an electrical shock to stop a shaking heart, VFib, and allow it to reset. Option C, to measure blood pressure. Option D, to provide oxygen. The correct answer is option B, to deliver an electrical shock to stop a shaking heart, VFib, and allow it to reset. AEDs treat ventricular fibrillation, VFib, they do not shock a heart that has completely stopped, asystole. Question 50. If you are alone and have no cell phone, what is the priority for an adult arrest? Option A, start CPR immediately for 10 minutes. Option B, leave the victim to find a phone/activate EMS first, then return to start CPR. Option C, wait for a passerby. Option D, give breaths only. The correct answer is option B, leave the victim to find a phone/activate EMS first, then return to start CPR. For adults, cardiac arrest is usually sudden, so getting professional help, 911/AED, is the priority. Question 51. When performing compressions on an infant, where should your fingers be placed? Option A, on the stomach. Option B, on the center of the chest, just below the nipple line. Option C, on the throat. Option D, on the ribs. The correct answer is option B, on the center of the chest, just below the nipple line. The correct location is the lower half of the sternum, similar to adults but proportionally smaller. Question 52. How many hands should you use for adult compressions? Option A, 1 hand. Option B, 2 hands, interlocked. Option C, 2 hands, side by side. Option D, 3 hands. The correct answer is option B, 2 hands, interlocked. 2 hands are necessary to generate the force required to compress an adult chest 2 to 2.4 inches. Question 53. What is the first step when the AED pads are applied? Option A, tell everyone to clear. Option B, perform 30 compressions. Option C, plug the pad connector into the AED, if not pre-connected. Option D, give 2 breaths. The correct answer is option C, plug the pad connector into the AED, if not pre-connected. The pads must be connected to the machine so it can begin the analysis of the heart rhythm. Question 54. A ventilation that is delivered too quickly or with too much force can cause: Option A, the victim to wake up. Option B, a pneumonia. Option C, gastric inflation, vomiting. Option D, a faster pulse. The correct answer is option C, gastric inflation, vomiting. Breaths should be delivered over 1 second to allow the lungs to expand naturally. Question 55. A child has a hairy chest which prevents the AED pads from sticking. What should you do? Option A, do not use the AED. Option B, use the pads to rip the hair off or use a razor from the AED kit to shave the area. Option C, tape the pads on. Option D, use adult pads instead. The correct answer is option B, use the pads to rip the hair off or use a razor from the AED kit to shave the area. AED kits usually contain a razor or a second set of pads for this purpose to ensure a good connection. Question 56. What is the chain of survival? Option A, a type of jewelry. Option B, a sequence of actions that, when performed quickly, significantly increase the chance of survival. Option C, a list of local hospitals. Option D, a training manual. The correct answer is option B, a sequence of actions that, when performed quickly, significantly increase the chance of survival. The links include early recognition, early CPR, rapid defibrillation, and advanced care. Question 57. When performing 2 rescuer infant CPR, What is the compression technique? Option A, two-finger technique. Option B, heel of one hand. Option C, two-thumb, encircling hands technique. Option D, no technique is needed. The correct answer is option C, two-thumb, encircling hands technique. The two-thumb technique is more efficient for two rescuers and allows for better depth and pressure. Question 58. What should you do if the victim's chest does not rise during your first rescue breath? Option A, give up. Option B, perform the head tilt/chin lift again to reopen the airway and try a second breath. Option C, start chest compressions immediately. Option D, punch the victim's chest. The correct answer is option B. Perform the head tilt/chin lift again to reopen the airway and try a second breath. If the first breath fails, the airway might not be open. Attempt to reposition the head once before moving back to compressions. Question 59. If a person is responsive but has heavy bleeding from an arm, what is the priority? Option A, start CPR. Option B, apply direct pressure to the wound. Option C, give rescue breaths. Option D, use an AED. The correct answer is option B. Apply direct pressure to the wound. Hemorrhage control is a priority life threat that must be addressed before the person loses too much blood. Question 60. Which of the following describes personal protective equipment (PPE) for CPR? Option A, a bicycle helmet. Option B, a pocket mask or face shield and gloves. Option C, a reflective vest. Option D, safety boots. The correct answer is option B, a pocket mask or face shield and gloves. PPE protects the rescuer from infectious diseases found in body fluids like saliva and blood.